What is Hilditch Connect and how can it help?
So Hilditch Connect is I guess, a separate business unit, for want of a better term. And the idea behind it is basically to utilize the data we have as a business. So we've been running a long time, as I've mentioned a couple of times, 35 years this year. And as I mentioned earlier, if we sell 3,500 assets per month over 35 years, do the maths very quickly, that's a lot of data. Most of those assets, if not all of them, we know the brand, we know the model, we know how old they were when they were sold, and we can start to add to that information how much they cost when they were new. So what did that assets machine cost on day one? When did we sell it? How old was it? And what did it sell for? So we've got this database. So the thought process back in 2017, 2018, it would be, was, well, what can we use this data for? It's a big conversation at the moment in many industries, data, how can we utilize it better? And we've got far more tools now to help us interrogate that data. So Hilditch Connect was born out of that database in terms of, well, who needs this data and how might they use it? So a couple of different options there. One is our work with lease companies, with finance houses, with banks, who are procuring or purchasing equipment and then leasing it into healthcare settings. So your hospital might be leasing a CT scanner, or it might be leasing a fleet of ultrasounds, which means that the hospital doesn't have the upfront cost. They're just paying a monthly fee. Just like leasing a car, you're paying a monthly fee over a set number of years, and then you give the asset back. How Hilditch comes into that is a couple of different ways. We can advise the lease company up front on what the depreciation curve for that specific equipment looks like. Again, going back 10 years, everyone was using the same depreciation curve. So we were making the assumption that a CT scanner from GE would depreciate in the same way as syringe drivers from Braun, which would depreciate in the same way as bladder scanners. And I'm sure you can appreciate with very, very different assets, very different items, very different markets you're selling to, very different age profiles, usage profiles, the depreciation is different. So what we try to do with Hilditch Connect is break that down by asset category. So looking at mobile imaging, fixed imaging, ambulance equipment, theatre equipment, breaking down by category, and then break it down further by brand, and almost in some cases now break it down by model. So we can compare the depreciation curve of a GE ultrasound to a Philips ultrasound to a Hitachi ultrasound. So when the lease company are looking at their upfront purchase, all of those ultrasounds are going to cost them some money. And when they're looking at what to charge a hospital over a monthly fee for leasing an asset, this allows them to do some planning around it. The second aspect of Hilditch Connect means when you're on the procurement side of things, so you're in the healthcare setting, let's call it the hospital, whatever, and you're looking at spending a significant amount of money on some new equipment, you can make some more informed decisions. If you're looking at certain models and brands, there's likelihood that after 7 years, 8 years, however long you intend to run them for, there's going to be a resale value of X. But if you're looking at some different models and some different brands and some different specifications, your resale value after 7 or 8 years might be Y. Again, you're probably going to compare 2 or 3 or 4 different options in terms of their upfront cost and their specification and their suitability clearly. But I think there should be a fourth or a fifth criteria there that says, what's the resale value? What's the likelihood? And I'm sure there's other criteria from an engineering point of view. How easy are they to maintain? Availability of spare parts, availability of training with the OEM, things like that. They're all considerations, and I don't envy procurement departments sometimes that they have to draw all this together. But I think resale value should be part of that. And what we're trying to do with Hilditch Connect is make that accessible, visible, and usable in terms of data, rather than simply presenting you with a massive database of 35 years of sale value.
And with that analytics, which you then get from Connect, is that something where you, as that selling Hilditch service, can present a point of purchase to procurement?
Yes, so we can give specific advice. We've got a couple of procurement departments we work very closely with, where we have specific conversations or write specific reports on certain markets at certain times. Again, the changes in medical equipment just in my time at Hilditch in the last 7 years have been vast. So we might have a procurement department who are weighing up several options. Let's stick with anesthetic machines. They might have a very well-established European company looking to sell them. They might have a newest to the market Far Eastern company looking to sell their anesthetic machines to the hospital, and they might have another North American company looking to sell. Where they're from is less important than the price points. They might have 3 price points, which means 3 different sets of training for their engineers to maintain them, or 3 different service packages. Might be 3 different spare parts costs, 3 different service intervals. All of that needs to be kind of fed in. But if they come to us with this information saying, look, we're comparing A to B to C, we've got 3 different costs on the table. What are we looking at in 5 years? What are we looking at in 7 years? And what are we looking at in 10 years in terms of resale value? We can give pretty specific advice on that. And to be honest, on a single asset basis, the numbers aren't huge because we're talking a percentage of their retail value. Obviously, you're going to spend £100 on an item today. In 5 years' time, it's not going to be worth £100. But if you're buying 100 assets today, £100, or 1,000 assets today, £100, looking ahead by 5 years, something becomes quite an important thing to do in terms of the financial outcomes.
Becoming more and more important. More questions have been asked around that.
Yes, it's becoming more of a hot topic as we as an industry become more attuned to this kind of thing. Obviously, resale has now been around a long time, is well established in the UK and across certain parts of Europe, but procurement departments are now cottoning on to the fact there might be an income stream at the end of this, and therefore we've got to consider both sides, the upfront cost now, but also the income.